Hi everyone, I'm Heather Stauffer, Legislative and Policy Advocate for CML. Thank you for attending today's webinar. For those of you who are just joining us, we're doing things a little bit differently. CALPHO was just finishing up their regularly scheduled meeting, and then now we're going to begin our webinar. So I'll go over a few details while they get ready. For those of you who are joining us for the webinar from CML, this webinar is being recorded and will be posted on CML's website at www.cml.org/COVID-19. If you aren't familiar with the webinar format, you should see a control panel at the top right of the screen. You have an orange arrow to the left of the panel, which will minimize the entire box. All participants will be muted for the webinar, but are encouraged to ask questions by typing them into the question box on the control panel. We'll hold a Q&A near the end of the webinar, but please feel free to type the questions as you think of them throughout the presentation. So I just want to go ahead and thank our presenters today, who are all members of the Colorado Association of Local Public Health Officials, or CALPHO. CALPHO is the professional association representing Colorado's local public health agencies. Their member-directed advocacy initiatives and research aim to improve the practice, structure, and financing of Colorado's public health delivery system. The members of CALPHO are going to talk to us today briefly about their phased framework for re-entry, which you can find on CML's website if you haven't already seen it. They'll then answer your municipal-specific questions about reopening and re-entry, which were submitted in advance, and then answer more questions you have as time allows. So at this point, I'll turn it over to Tracy Anselmo, the Executive Director of CALPHO.
Hi, everybody, and I want to thank everybody for joining us today. I am gonna, I know I was supposed to have pulled up the framework, and I just realized that I hadn't. And I just want to briefly go over the framework that CALPHO provided and submitted to the governor's office back in late April. It really covers what we feel is best public health practice for containing and mitigating the COVID-19 illness, and we outline some very specific criteria of conditions that need to be in place prior to moving into relaxing the stay-at-home orders into the safer-at-home orders. And one of the things that we really want to emphasize today is the folks on the line from CALPHO are your points of contact for information regarding what this all means and how to make this happen. So I will certainly encourage you to reach out to your local public health agency directors who are on the call today, and they can be found either by connecting with Heather or myself. And we are happy to share this time with you to answer some of the questions that you have. So Heather, I just want to verify that our roadmap is up. Somebody let me know that you're seeing.
It is. All right.
Okay, that's okay. That's okay. So the things that we want to make sure we're considering before we are looking at relaxing any of the limitations on group gathering sizes are a sustained decrease in cases for 14 days that are reported through data, that hospitals are able to safely treat patients, so there's enough hospital beds, ICU beds, and all of the other equipment and personnel necessary for that, that testing can be performed with folks that are symptomatic, and we're working towards improving that to include folks that are not symptomatic because we know about asymptomatic transmission, that we can actively monitor. And if you joined the last 5 minutes of the conversation we are having with the CALPHO members, is how monitoring occurs through data, whether it's mobility data or testing data or information about hospital capacity. And then finally, that there's clear protocols in place for social distancing. So I'm going to stop there on the review of the framework and actually go back to the questions that you all submitted ahead of time. And any of the CALPHO members that are willing to take the answer of this question, just raise your hand and Heather or Courtney will unmute you so you can speak. So for temperature screening, what are some of the practical tips for both large cities and small towns on how to conduct these safely and efficiently? Anybody? I do know that the Colorado Department of Public Health and Environment just issued additional guidance on employee screenings prior to entry, and they are allowing employees that say are going to a site, such as a construction site or a delivery driver, to do a symptom check at home. And there have been conversations about different ways to collect that screening information. Obviously, a thermometer is necessary. They were talking about pulse oximeters, but by the time that would be needed, the symptoms of the disease would probably be present. But I welcome anybody from CALPHO to chip in any of this conversation. All right. What are your suggestions for conducting meetings if the normal meeting rooms are too small for both regular staff meetings and for public city council meetings? Also suggestions for how to allow the public to participate in council meetings in a safe way. John Douglas, do you want to take a stab at that? And I know that El Paso County is also holding meetings right now virtually. Any CALPHO members want to speak up on that?
Hi, Tracy. It's Journey Reynolds in Gunnison County. We're using Zoom to support our public notice and public meetings for our Board of County Commissioners. And in addition, some of the communities in Gunnison County are doing that similarly. So some of the council and board members are on Zoom, some are present in the room, and all participants can go through Zoom to participate.
Great. I have seen also a number of organizations using the Facebook link. Zoom allows that, and so you can broadcast directly onto Facebook. The governor holds his press conferences that way as well, and it doesn't necessarily require a bunch of additional technology to allow that. Any other CALPHO members?
Yes, this is Dave Frank. I'm on the City Council of Montrose, and do all of our meetings now on Zoom. And we have figured out ways to include the public comments to allow them to be included as a panelist on our Zoom calls, so we can have public comment. We also record and broadcast both on our live stream on our TV station, and we also have it recorded and archived so people can participate even that way.
Awesome. Any other CML members doing some creative meeting solutions?
This is Amber Blake from the city of, go ahead.
Go ahead.
It's Amber Blake from the city of Durango. We are working towards what Montrose just announced that they were doing with the panelist for public comment. And I'm wondering for Montrose if you are live streaming your study sessions as well, or just your meetings?
I'm willing to answer that from the city of Inglewood and what I think most of the metro area is doing. Can you hear me?
Yep, we can hear you.
Yeah, I think almost the entire Metro Mayor's Caucus folks weighed in on this. Almost everyone is using Zoom or some other format and have been holding meetings. We've been holding in Inglewood meetings for probably 6 weeks on Zoom, and our study sessions as well, and they go out on live streaming. And we also, as Montrose has discovered, doing the public input through the panelist possibility, as well as people showing up and asking questions, both pre-planned and unplanned. And our Planning and Zoning Commission and our Water and Sewer Board are now up and running for Zoom as well. We're not planning to go back to the office or to the meetings in rooms probably until mid-June. It could be earlier than that if things go well, but could be later than that too.
Sharon Thompson wrote that Fountain is using this platform as well. Citizens can submit questions in advance or ask questions during the meeting. Sharon, if you'd like to add anything else, you can unmute yourself.
Yes, hi, this is Sharon. It has worked, I think, really well. Our IT department are really the unsung heroes in this whole thing. They researched and have done tons of work to get our meetings going. And the platform, this particular one is kind of fascinating to be on the other side of it. I hadn't seen the other side of it till this meeting, and it's kind of fun. But our citizens seem to be liking it, and we don't have a plan for when we'll be back in the rooms yet.
All right, good input from your peers there. So should cities and towns be providing masks for staff and or the public who enter buildings? I do believe that the orders say that it is the employer's responsibility to provide masks for employees. Anybody want to weigh in on the public who enter buildings? Some areas, I know Wheat Ridge has required that folks wear masks in public. But does anybody else want to comment?
Hey Tracy, this is Jeff with Boulder County Public Health. And
Perfect.
what we're doing is we are still encouraging, even though we're currently closed until the end of May for in-person services. But what we are doing is we are working to encourage people to continue to use our remote services wherever possible, because we know that as we move forward, we're going to continue, we expect to continue to see some resurgence of cases, and are wanting to make sure that we're minimizing social distancing as much as, or maximizing, sorry, social distancing to the maximum extent. So we are only doing in-person services where it's absolutely necessary. Where those in-person services are having to happen, we are providing masks for the public that come in for those in-person services, and we're using social distancing mechanisms to make sure that we can, to the maximum extent possible, keep people separated and apart.
Thanks, Jeff. Anyone else like to respond? And I think that somewhat answers question 4. If it does not, please go ahead and unmute yourself and let us know if you need further clarification on whether public buildings can require visitors to wear masks. We have a person, oh, go ahead, sorry.
This is Linda Olson, Mayor of Inglewood again. We are requiring the public to wear face coverings when they come into city buildings, and we are buying them if they don't have them. If that runs out, we'll just turn them home probably, and we're providing them for our staff as well.
And Mayor, are you also having limited in-person, trying to limit in-person services as much as possible?
Yes, absolutely. We're trying not to bring employees in if we don't need them either, but we do need to get some things up and running. So it's still being rolled out. But Monday night, we did as a council approve a resolution for a strong recommendation for people to wear them in the public. We did not mandate it, but we did a strong recommendation. There was quite a discussion about whether we should be doing anything at all because there's such limited and different views on whether face coverings do anything or not.
Hey, Tracy, this is Heath in Eagle County. I think maybe I would offer up that regardless of what policies are put in place at a county or jurisdictional level for the public, each entity always has that ability to develop and implement policies that are specific to their buildings or their locations. So I think for us, as an example, in Eagle County, we have not required face coverings in public. We strongly encourage that. There's only specific times when you can't separate for prolonged periods of time in certain job functions where that requirement exists. But that said, there are still a number of employers throughout our county that are actually implementing those face covering policies for when you are actually coming in to receive a service. I think also a lot of public transit that is still operating has implemented face covering policies. And so I know at least for the number of public transit services that are here in Eagle County, they all require that. And at the same time, I believe each of them is also offering face coverings to those that need to ride the bus but actually don't have a face covering.
We have someone asking, her name's Crystal, what the best way to handle a scenario in which an employee or a visitor is refusing to wear a mask.
This is Tom Gonzalez, Public Health Director for Larimer County, and we received some of those for businesses. And I think it's important to remember that the mask protects those around you, not necessarily you. And we've heard from our businesses throughout the county that they're wearing their face, the cloth face coverings to protect the customers as well as their fellow employers. So I think it's just important to really educate the customer that this is to protect the employers that are here working. And we've had a couple occasions where folks have become very resistant and even somewhat agitated. And at that point, we just say, hey, let's just really work on social distancing. I wouldn't get to a point where you're kicking them out of the building. I think we're all under big time stress. Let's try to meet everybody as best we can, encourage the good education. We're providing our businesses with good handouts, and we're trying to even educate more with the city of Fort Collins and Estes Park, who have also done their own face covering orders. But I think it's important to just understand where everybody's at. And if somebody does refuse, let's not make a big scene. Try to maintain your 6 foot physical distancing and carry on. That's what we're doing in Larimer.
And this is Heath one more time in Eagle County. One of the things, because we get this question all the time, face coverings probably is coming up so much for all of us, but still all the science that certainly I have seen, and I think that would be true for most of my colleagues on the line, is going to indicate first and foremost the distance is the best protective measure that can be taken. Outside of that distance, you can look at making changes to the environment that further reduce then either that proximity or the close contact with one another. And then you can always make administrative policies such as a face covering or limiting then staffing in one location at a time. But all of those measures, the distance, the environmental changes you can make, and the administrative policies are all more effective than the personal protective equipment. It's not to say the personal protective equipment is not important, like Tom really indicated. It's really to protect others versus the individual that's wearing it. But nevertheless, I think it's always helpful just to kind of keep in mind the distance seems to be one of the most effective ways to actually decrease transmission for this particular virus.
Hey, Tracy, this is Jeff Zayak once more from Boulder County Public Health too. The other thing I would offer is I would bet that most of us on the phone are developing plans for our own workplaces. I know we are in Boulder. And when those are completed, we can certainly share those so others could look at those if that would be helpful. And I don't know the best way to do that, but we'll certainly share ours if others want to take a look at it.
You guys can send those to me. This is Heather Stauffer from CML. And I think that would be very, very helpful for our membership, and we can distribute those.
Great. Thanks, Heather.
Thank you.
So that actually leads us into the next couple questions that I see, which is staffing. We have a vulnerable individual who wants to work? Can we let them? And if so, are there any suggestions on how to do that safely? Should they sign a waiver? And do you recommend phasing in your staff to coming back to work? And do you have suggestions for the best way to do this for a small to medium-sized city? I think as Jeff suggested, as they're sharing their own, as public health agencies are sharing their own plans to get folks back safely to work, some of those questions may be answered. And if you have specific questions, maybe reach out to your local public health agency director and see if they can help you walk through what that might mean. There is a question about should we allow public use of restrooms? And I know that there were some conversations about sanitizing restrooms for other areas like rest stops and other public places, but I'm wondering if anybody has a response to that.
And this is Heath again up in Eagle County. I'll be happy to offer some insights here. I think on both of these questions, I'll talk about the bathroom use, but in general, I think it's always going to be true that what we need to do is also continue to remind folks what their individual responsibilities. So realistically, I think each organization has the opportunity to think about what their cleaning protocol should be to any areas that are going to be high touch and open to the public. So restrooms would be included. So you might consider what the cleaning protocol is and the frequency of that cleaning. And that said, I think any public that's using a bathroom in a public building should always just be reminded that they need to really take the responsibility to wash their hands as they're exiting that restroom. And we know that public restrooms in a number of different areas are open already. So I think we're just trying to make sure that people really understand if they're going into a restroom, whether it's in a Walmart, whether it's in a local park or something like that, that still there is a personal responsibility to wash your hands upon leaving the restroom or as you're exiting. Also in terms of recommending phasing in your staff and coming back to work, I think that makes an awful lot of sense. Realistically, you need to kind of consider what your space looks like. Are they individual offices? Is it a lot of open office environments and things like that? So I think phasing it in, or I should say staggering the schedule from when folks are going to be in the office is an important consideration based on the size and the type of office that you have. I think also relative to phasing, sometimes you can also consider what are the most essential services that you're providing to residents that need to continue to operate. And that also may be a good way to think through how you rephase or how you stagger some of those staff coming back. Telecommuting is still going to be recommended. That's an easy way that you can ensure safety of workforce while also decreasing then some of the resource needs when you're actually bringing people back into the office. But in general, I think we are looking at that for Eagle County government is developing sort of that plan and staggering this not only in terms of who's coming back into what offices and when, but also specifically because we have open office environments and in some areas where multiple staff share an office space or at least a smaller general area, we're looking at ensuring in those areas that we have staggered work schedules so that they're not necessarily sharing at the same time. So I hope that helps.
Any advice on addressing fears in folks as they're returning to work?
Hey Tracy, this is Katie Davis in Pueblo. We've had our staff working this entire time, but that has definitely come up on occasion, and we've just tried to continually help staff to, first of all, come forward if they do have fears, and then if there are things that we can do to kind of minimize some of that. We have a couple open offices, so we've offered that or different space, but we've tried to talk through all of the precautions that we've already put in place as far as social distancing and half the staff not being here and all of those things to try to mitigate some of that. And that seems to have worked pretty well to just have that open conversation as they start to come back into the workplace.
And I think that this actually leads to question 12 too, which is, are there additional resources for municipalities who want to promote good mental health in addition to physical health among their residents and or their employees during this pandemic? And I do know that we have been contacted to connect the mental health centers folks to communities across the state. And I think there have been some good resources made available on the COVID-19 website through CDPHE and the governors. And we can make sure that Heather is aware of where those are so that she can link you all to those, because we do know that this is a significant issue related to folks' mental health and well-being during all of this. Does anybody want to refer or discuss any additional resources that might be available for mental health during this pandemic? All right. Advice on reopening municipal swimming pools and park and playground equipment. Who wants to answer that?
Hey, Tracy, this is Jeff Zayak with Boulder County Public Health again. And I believe in the safer at home order that we have right now, those are not allowed to reopen. And the reason being is that right now there's a limitation on gatherings of no more than 10 people. And it is likely that we will remain in that for a little while until we're sure that we're not seeing increased cases. We know that until really related to a lot of the questions here that are being asked related to what we expect to see with this virus, we know until we have a vaccine or a treatment, we're likely going to have to do the best we can to maintain our social distancing and to reduce large groups from gathering together, because we don't want to spread this further and then have to go backwards in this whole process. So I know that's been the approach of the state. It's been the approach of a lot of us that have been talking on the phone as well. So we definitely want to limit those places where large group gatherings are likely to occur.
And I would bet that a number of the CML folks are on the local government's calls that happen a couple times a week. And a number of these questions were asked of the state representatives on those calls, and particularly around sports programs or gatherings. And what Lisa Kaufman said is that it will likely be July or August before there's enough information to make a determination about the next stage, and that they are basing their phasing of the relaxing of these group gathering sizes on a transmission risk profile, understanding that the smaller groups have less likelihood of transmission risk to the larger public. So we will continue to be looking for those guidances as well. And I think that they're really waiting for the data to come in over the next month and a half to figure out what the next round of guidance will be. Are there any other questions in the chat?
This is Michael from Castle Pines. I'm curious, and maybe I missed, did that statement around parks and playgrounds, was that for outdoor swimming pools as well?
Yes.
Thank you.
Mm-hmm.
Great. So I do have a couple of questions. I have a few circling around temperature checks. For example, people are wondering if it's worth doing temperature testing if people are asymptomatic. Another question is if is temperature screening required if you have less than 50 employees in the same location? And another one is just a general question if people are doing public temperature checks.
I'm going to punt that to my members.
This is Dave from Montrose. One of our local businesses has like 48 employees, and they have been doing temperature checks every morning since the beginning of the stay-at-home order, and have found that to be a great and useful tool. But the lawyer that they have on staff told them that they cannot require it, and they cannot record the name or the temperature of the person being tested. So there's a lot of weird little legal issues about that, it seems.
Was the lawyer implying it was a violation of HIPAA?
I'm not really clear on whether it was a violation of HIPAA, but they said you cannot record the name of the person, you cannot enter their temperature into their personnel file because it's a violation of some labor laws. So I'd be curious to hear some comments or insights from people on that.
This is Amber from the city of Durango, and we were looking at that same issue. And right now, my understanding is that we will be using ID numbers, so employee ID numbers for our tracking sheets to protect the privacy of the individuals for tracking.
Lori Weisner is curious if any documentation is needed for doing temperature checks.
I'm going to go out on a limb and I'm going to ask any of the CALPHO members to correct me if I'm wrong. So part of this is about contact tracing. So if somebody becomes symptomatic and it's noted in a temperature check, then that allows a way for public health to follow up with folks that may have been in contact with the individual that became symptomatic and potentially eventually tests positive. And to make sure that if they are becoming ill, that they can be sent home as to not increase a potential exposure to their coworkers. So does anybody from CALPHO want to elaborate on the temperature check log stuff? Any other questions, Courtney?
Yes, we have another question that came in around phasing in. The question is, what about locker rooms and recreation facilities?
Jeff, do you want to take that, or Tom?
So I don't know what the reason I'm hesitating is I'm not sure exactly what it says in Safer at Home, but I can tell you in general what I said before, which is how we're in Boulder County, this is how we're approaching all of it. We really are working very diligently to not have people come back to work if they don't have to. We are making sure that we're minimizing and providing guidance to all of our businesses around maintaining that social distancing of 6 feet. So anywhere where you could potentially have people gathering together is going to be a challenging situation for us because we don't want this virus to spread. So if you can minimize that at all costs, we should minimize that, especially until we start to see data and what happens over these next several weeks. And as we get closer to hopefully a vaccine or treatment. So I think it's just going to be a challenge to bring big groups of people together. And the more we can avoid doing that, the better off we're going to be and not having to work backwards. I think none of us on this call want to go backwards. And the better we can control the spread of this by maintaining that social distancing, the better off we are moving forward. Maybe somebody on the call knows for sure what it says in that safer at home order.
This is Melissa Sager from Tri-County Health. Currently, rec centers are closed under the Safer at Home. It does not provide additional guidelines for phased-in opening.
Keith is recommending that people look at the CDPHE guidance on locker rooms and waiting rooms.
All right, any other questions? If not, I think we can set loose the CALPHO members, and if the CML members want to continue to converse or have, you guys have anything else, other business that you want to cover?
I do have multiple questions. I'm sorry to interrupt.
Oh, okay, that's all right.
So Kelly is asking a question regarding the maintenance of public pools and if any municipalities are facing resistance from, public restrooms, excuse me, and if any municipalities are facing resistance from employees to maintain or clean those despite utilizing best practices.
From the custodial staff, I would assume the question is related to custodial staff resistance.
Yes, I'm going to assume so. Yes, she said. And we also have a question along the same lines in a way from Justin on whether or not it is recommended to have staff sanitize public restrooms and public spaces after every use or multiple times a day.
So this is Jeff with Boulder County again. And we have had this question come up with our Parks and Open Space folks and our regional trails group. And definitely just using precautions. So having somebody make sure that they are wearing protective equipment when they're cleaning restrooms. There is guidance for that. I'm happy to share that with you directly. And making sure that restrooms are cleaned frequently. The primary mode of transmission is not from a deposition surface, so not where the virus has landed on a surface and then is being transmitted to somebody else. It's really that aerosolization and the transmission directly from droplets from person to person. So there's less risk associated with cleaning a restroom than there would be if you were in close proximity talking with somebody. So we have put together guidance around that for all of our parks and open space restrooms that could be applied directly, and I'm happy to share that directly with you.
Jeff, Kelly would like that information, and I will connect you guys after this this call.
Thanks.
Other questions, Courtney?
Yes, sorry. So the next question is from Nicholas. Nicholas is wondering what people are doing with dog parks.
This is Heath in Eagle County. I think when we were still under the more restrictive order where groups or gatherings of any size were prohibited, we had closed down dog parks. I think for a lot of the similar reasons that Jeff was just highlighting, it's really just that space where folks were congregating, and it's hard to kind of control the dogs from getting together, bringing people then within that 6 feet of distance. And so we did that for a period of time, but now that we've started to roll back some of the restrictions, we've opened up those dog parks again with some other guidance really in terms of just signage to ensure that people are really following and adhering to that 6-foot distance. Also, I would offer up that for a period of time, we also implemented a leash law, just aimed at trying to kind of help ease some of the concerns from some of the residents. But at this point in time, we have deferred basically back to each jurisdiction's leash law to be in effect. But again, our dog parks are open, and we've done a lot in terms of signage just to help remind people to maintain that distance while they're at the dog park.
Great. So I've gotten a lot of questions asking if Jeff, you'd be willing to share that information with everyone. It seems like a lot of people are very interested in it. If you could send that to me after the call, that'd be fantastic, so we can share it with others. Our next question comes from Robert. He's asking if the amount of chlorine in the swimming pool is sufficient to kill the virus.
Hey, this is Heath in Eagle County, and so I think the chlorine definitely offers some disinfectant qualities. I think so. At least the water in swimming in and of itself is probably not the concern at all relative to the virus. The one thing I would just highlight, at least what I've read, is chlorine, bromine are good. Right, what they'll do is they'll kill the virus. Saline, not so good. I know that saline is actually used as that viral media transport for a lot of the specimen collection that's happening with COVID-19 right now. So at any rate, I think it's important to kind of acknowledge that the disinfectant that's being used is going to be a key indicator in terms of what that risk looks like. But I'll still go back to what Jeff in Boulder County had highlighted. It's really about congregation size. I'll add in also that not all pools are created equal, right? There are some large open sort of 0-degree entry pools that are really targeting for kids, and it's really hard to control the interactions that kids might have with other kids in that pool setting versus, say, a lap pool that is specifically designed for swimming laps or something like that. So it's hard to provide blanket guidance for every situation, but I would just kind of indicate the gathering size, the ability to control people from gathering while in the water are always going to be considerations in terms of pools opening and what the risks might be even outside of then the disinfectant for the water itself.
Great. So our next question comes from Austin, asking if communities are allowing community gardens to remain open.
So I will answer that Jefferson County provided some examples of how they are recommending community gardens function as a food source. And I can share that with you all at CML.
Yeah, that would be great. And we can get it posted to our website with this information for the webinar.
Mm-hmm.
So our final question right now comes from AJ, wanting some clarification on outdoor recreation businesses, for example, motocross, go-karts, and paintball. Those cannot be open because 10 or more people would be gathered, correct?
This is Jeff in Boulder. Now that I know that Melissa's on the phone, I'm sorry I'm doing this to you, but you know this order so well. I'm wondering if you can answer that.
Yeah, these outdoor activity businesses are one of the things that we're waiting for updated guidance from the state on. They are not permitted currently under the order, under the Safer at Home, but we do anticipate guidance coming soon. But yes, it would violate the 10 or more.
Thanks, Melissa.
Great, thank you. And we had one more question come in from Lynette asking, I am from a small town and have businesses being threatened of closing down. I am concerned with this as it is a devastating loss. Is anyone offering support?
We may need a little bit more clarity, financial support, or
Lynette, this is Heather Stoffer from CML. I would encourage you to look on CML's website for some links for small business resources that may be helpful.
Lynette, you also clarified mental health, and just so everyone is aware, there was a website shared that from Jeffco, apparently has a really good webpage dedicated to mental health. That information will also be shared at the end of this webinar and posted to the CML website.
Hey, this is Morgan Hill, also with Eagle County. And actually, I had a thought on that when the mental health question came up earlier. And it's pretty preliminary for us, but we're talking about how we can maybe incorporate some of those mental health questions into kind of employee wellness checks. That was just something that came up today, is a kind of more one-on-one touch point between the employer and the employee, nothing with a screening that gets recorded, but just kind of a checkpoint.
Great, thank you. Our next question is from Julie, asking if there's any guidance or restrictions on day camps or licensed summer day camps.
This is Melissa again. I can answer that. We do anticipate additional guidance coming from the state specific to summer camps, but the governor yesterday did say that summer programs are permitted to operate under the existing childcare guidance. We anticipate further guidance from the state, but that childcare guidance would facilitate summer camps currently.
Thanks, Melissa.
Thank you, Melissa. Now from John, he's asking if municipal courts are allowed to reopen.
This is Melissa again. Yes, municipal courts are essential under the order. They have been asked to limit the number of folks coming in and to provide all services to the greatest extent possible remotely. We have been talking in Tri-County to our districts about what reopening can look like, and we'd encourage courts to reach out to their local LPHAs to chat that through as well.
And Melissa, it seems we have another question kind of for you. Keith is asking if you can explain the childcare summer camp connection.
Yeah, so the summer camp being the care of children, that's how the connection was made between the childcare guidance. So currently under Safer at Home, the governor has issued, or CDPHE has issued guidance for childcare facilities. And so a summer camp is caring for children, and they can operate under those requirements. There's a variety of different requirements under there, like no more than 10 children in a group.
And let me just clarify, that's for day camp, not for overnight or residential camps. So the governor equated child day camps as comparable to childcare, but no overnight or residential camps guidance at this time or allowance.
Great. Okay, so it seems like those are all the questions that we have at this time. Heather, would you like to say anything?
Yeah, I just want to thank Tracy and all of our speakers from CALPHO for their expertise and advice. And just as a reminder to webinar participants, this webinar is being recorded and will be posted on the CML website at www.cml.org/COVID-19. So thank you again to our presenters.
And I really appreciate the opportunity to connect with our municipal partners, and please don't ever hesitate to reach out to your local public health agencies. They are there for protecting the public in the county and all of your cities, towns, and villages in the state of Colorado. And we hope that this is an opportunity for continued partnership as we move through this all together. Thank you, guys.
Great, thank you so much.
Thank you very much.
We really appreciate everyone taking the time to join today. This does conclude our webinar. Just to repeat what Heather said, This information will be available on the CML website at www.cml.org/COVID-19. This concludes our webinar. Thank you all for attending, and I hope you have a wonderful day.